Welcome back, Truth Helpers. Another YouTuber brought this article to my attention. I'd like to read it to you. Due to extremely rare situation, woman suffers brain fluid leak from CV swab. A CV nasal swab test punctured a U.S. woman's brain lining, causing fluid to leak from her nose and putting her at risk of life-threatening infection, doctors reported in a medical journal Thursday. I'm going to show you 3 pictures of how the test is done. You might want to close your eyes. It's a little bit graphic. And it's using a very long Q-tip-like thing. You may have seen some pictures online. So you can close your eyes for about 9 seconds, and when I begin talking again, you can open your eyes and I'll read the remaining of the article. The patient, who is in her 40s, had an undiagnosed rare condition, and the test she received may have been carried out improperly. A sequence of improbable events that means the risk from nasal tests remains very low. But her case showed healthcare professionals should take care to follow testing protocols closely. Jarrett Walsh, senior author of the paper that appeared in JAMA, Otolaryngology, Head and Neck Surgery, told AFP, which is this site here. People who had extensive sinus or skull-based surgery should consider requesting oral testing if available, he added. Quote, "It underscores the necessity of adequate training of those performing the test and the need for vigilance after the test has been performed," unquote, added ear, nose, and throat specialist Dennis Krause of Lenox Hill Hospital in New York, who wasn't involved in the paper. Walsh, who practices at the University of Iowa Hospital, said the woman had gone for a nasal test ahead of an effective hernia surgery and afterward noticed clear fluid coming out of one side of her nose. She subsequently developed headache, vomiting, neck stiffness, and aversion to light, and was transferred to Walsh's care. She had been swabbed previously for another procedure, same side, no problems at all. She feels like maybe the second swab was not using the best technique and that the entry was a little bit high, he said. In fact, the woman had been treated years earlier for intracranial hypertension, meaning that the pressure from cerebral spinal fluid that protects and nourishes the brain was too high. Doctors at the time used a shunt to drain some of the fluid and the condition resolved, but it caused her to develop what's called an encephalocele, or a defect at the base of the skull which made the brain's lining protrude into the nose, where it was susceptible to rupture. This went unnoticed until old scans were reviewed by her new doctors, who carried out surgery to repair the defect in July. She has since fully recovered. Walsh said he believes the symptoms she developed were a result of the irritation to the lining of the brain. If the problem hadn't been treated, she could have developed a potentially life-threatening brain infection from bacteria that traveled up the nose. Or air could have entered the skull and placed excessive pressure on the brain. Most testing protocols call for clinicians to follow the path of the floor of the nose, which lies above the roof of the mouth, rather than pointing the swab up, or if they point it up, to do so with great care. Walsh said that though this was likely a very rare occurrence, it was a reminder of the need for high-quality training, given that hundreds of million more tests will be performed before the pandemic is over. So we're required to wear masks now. It's not a law. You're not going to be arrested if you don't wear a mask, but I see most people are wearing the mask. And I'm wondering why there's not just a saliva test rather than be so invasive with the swab, which is like 2 feet long and it's going up your nose. And a lot of us are sensitive. Most of us have never had anything put up our nose. And it sounds like if you have a rare condition, which you may not know that you had damage up there, it could really cause you maybe even to get a really bad infection. And who knows the people doing the test? Do we know if they're properly trained? Are they nurses or are they just people hired off the street? I mean, we have to be really careful what procedures we agree to, because we know that many mistakes are made in hospitals, and nurses and doctors make mistakes. They are humans. I can tell you many different stories of my family. Some of my clients have revealed some horrific stories of mistakes made to them when they were in the hospital or even in like the doctor's office. So we have to be careful what we agree to, because if you saw the 3 pictures that I showed, it's a little bit upsetting to have something put up your nose so long and how far up they're going. I mean, what if they're mad that day and they jam it up your nose, and who knows what damage could be done, and who knows if it's even clean. And they're doing this test in the car. You're pulling up. That is not proper procedure. It's a medical test. It should be done in a sanitary location. Now, most hospital workers and myself, a massage therapist, have been trained in universal precautions, which is an actual real thing. And there are guidelines for how to keep your area clean and how to wash your hands and etc., etc. But these tests are being done in your car, and the people are dressed like they're going to the moon, and then they're putting this swab up your nose that's now outside with germs and etc. And there are some people that don't believe in the germ theory, so you make your own decisions about whether you think this is contagious or not. I will not talk about it because I need to protect my channel. And by the way, if you could right now just click that thumbs up for me, it helps other people find the video. And click subscribe if you like, and the bell next to it allows you to get notifications when I upload new videos. So I really appreciate you're here. I'm going to read now from an article from the FDA website about home tests that are available, and they are a test that's done in your home by you, but it's still a nasal test. Apparently, what I read, this was, I think, months ago, for the CV, you would perform your own test so you would know how comfortable you are with putting the swab up your nose. So I'm just questioning now, this whole point of my video is, why aren't there a spit test, just testing your saliva? Like when you get tested by 23andMe, they send you a vial and you spit in it and send it back to them, and then they tell you about your ancestry and or medical conditions that might be in your genetic material. So the nasal test's too invasive for me, but you make your own decisions and do your own research. Don't just rely on me, but I thought this would be very interesting, and I thank you so much. You guys are great. You're stopping by, watching. I appreciate any comments, and I love you all, and have a great day. The U.S. Food and Drug Administration authorized the first diagnostic test with a home collection option for CV. Specifically, the FDA reissued the Emergency Use Authorization, EUA, for the Laboratory Corporation of America, CV test to permit testing of samples self-collected by patients at home using LabCorp's Pixel a home test collection kit. Throughout this pandemic, we have been facilitating test development to ensure patients access to accurate diagnostics, which includes supporting the development of reliable and accurate at-home sample collection options, said FDA Commissioner Stephen M. Hahn, MD. The FDA's around-the-clock work since this outbreak began has resulted in the authorization of more than 50 diagnostic tests and engagement with over 350 test developers. Specifically, for tests that include home sample collection, we worked with LabCorp to ensure the data demonstrated from at-home patient sample collection is as safe and accurate as sample collection at a doctor's office, hospital, or other testing site. With this action, there is now a convenient and reliable option for patient sample collection from the comfort and safety of their home.